self-excitation and conduction of the heart. Firstly, sinus node that control the heartbeat. Remember, sinus node that control the heartbeat. From sinus node, how the action potential generate, how the fiber excite. That's the main point. Look at our heart. Sinus node here. Now, they have sinus fiber. In the sinus fiber, when acetylcholine released at vagus nerve, acetylcholine released as vagus nerve, when acetylcholine released at vagus nerve, that affects and larger amount of permeability, potassium ions. In the sinus fiber, when leakage of potassium ions outside of fiber membrane, when potassium ion outside of the fiber membrane, it also leakages the calcium ions and sodium ions. When leaking of calcium and sodium ions, these processes are totally slower. Why this process is slower? Why sodium potassium ion when goes outside are slow? Because of greater negativity of resting potential membrane. Negativity of which is 65 to 75, which is resting potential of sinus fiber. The normal, which is negative 55 to negative 65, resting potential normally negative 65 to negative 55. Now, how can we know that negative resting potential increased? This is due to the slower potassium ion leakage outside of the cell in the sinus fiber. This leakage, leaking the calcium and sodium ions, when greater negativity of sinus fiber, the continuously action potential generate. Due to the continuously action potential, excitation goes into the internodal pathway, into the atrial pathway, and the other branch of the heart, which is right bundle branch and left bundle branch. The action potential at least goes into the AV node of the ventricular fiber. Remember here, it's due to the sinus node, because sinus node control the total heartbeat of the heart. When greater negativity of sinus fiber, it excites and heartbeat produced.